Cancer is a disease of cells. Cells that become abnormal and grow out of control and develop a lump or tumour that form into a cancer. So the idea behind treatments of cancer is actually we want to stop that cell growth. We want to kill and destroy the cancer cells and stop it from forming. There are sort of three main treatments for cancer: surgery, radiotherapy and chemotherapy. But there are other treatments also that we use as well, and I'll talk about those. So surgery is usually the treatment of choice and the first one that we'd really like to use. And this really involves an operation to surgically remove or cut out the tumour, the whole of the tumour, or maybe just part of the tumour. Unfortunately, a lot of tumours, when they're well advanced and they've grown quite a bit, will have their own blood supply, and they may have also invaded tissue or wrapped themselves around different organs. So unfortunately, sometimes we can't surgically remove them because the risk is too high to a patient. For example, they might bleed, or we might damage some of the organ and we'll lose the function of that organ. So surgery, although it is the best treatment, is not always the treatment that we can go for first. Radiotherapy is another form of cancer treatment, and this is where we use radiation to treat the cancer. Now, we talked about previously how radiation can actually cause cancer by damaging the DNA within the cells. So what we do is we harness that property and we give a really high dose of radiotherapy very specifically just to those cancer cells. And the idea behind that is that we'll destroy them and they will die, and hopefully that cancer won't come back. Chemotherapy is another very common anti-cancer treatment. It literally is chemotherapy, chemical therapy. We know that there are specific drugs that we can give that acts almost like a poison that destroys the cancer cells. Unfortunately, the thing with chemotherapy is that it attacks normal healthy cells as well as cancer cells, and that's why our patients get lots of side effects, which I'll talk about in a moment. The beauty of chemotherapy is that we can give it in a variety of ways. We can give it as a tablet, we can give it as a cream, we can give it straight into the muscle, for example, or the fat tissue. But more often than not, the most common way that we give chemotherapy is with an intravenous infusion, so straight into the blood supply. There are various other treatments that we're learning about, and through research we're developing. So, for example, targeted therapy. Sometimes they're called golden bullets because they literally just attack the cancer cells. And obviously that will help with the patient not getting so many side effects. There are lots and lots of new drugs that are becoming on the market through research. So, for example, some of the drugs can actually stop the tumour's blood supply and then it will lead to the tumour dying off, or it attacks the growth factors on top of the cancer cells so that they can't grow and divide. Unfortunately, there are many side effects associated with cancer treatments. And the reason for this is very often that we are attacking the normal cells as well as the cancer cells. Therefore, this means that the patient will get lots of side effects. For example, nausea and vomiting, hair loss, for example, fatigue, so extreme tiredness. And there are many, many more, very specific to the treatments or the drugs that patient is receiving. And the more we know about these drugs and the side effects, the better we are becoming at managing those side effects. And therefore, what we're hoping is that the patient will therefore not suffer from side effects as much, or at least we can manage them so they're not becoming too ill during their cancer treatment.